Hello, everyone. Welcome to the Molar Academy. Today, we're kicking off an important new series focused on medical emergencies in a dental office. It's crucial to prepare for these situations, and the best way to handle emergencies is to prevent them from happening in the first place. So how do we do that? First and foremost, a detailed medical history is essential. Spend those first few moments asking about the patient's medical history, including any existing diseases, conditions, and allergies. It's vital to know if they've had previous surgeries or what medications they're currently taking. Make sure to specifically ask about things like anticoagulants or asthma medication, and don't forget to list all medications in their record. You might also consider using a risk assessment form to help identify higher-risk patients. When the patient is settled in the dental chair and before you proceed with any treatment, take their vitals. Measure their blood pressure, respiratory rate, and oxygen saturation. These steps are invaluable and can help you catch any potential issues early on. Next, let's address anxiety reduction. A calm and stress-free environment can help prevent complications like syncope or hyperventilation, which often stem from patient anxiety. How can you create that calming atmosphere? Explain procedures to the patient clearly and patiently. No surprises. This anxiety reduction protocol is so important that we'll dedicate an entire video to it later in this series. Now let's talk about scheduling. It's vital to schedule appointments wisely. For instance, patients with heart conditions should ideally be seen in the early morning when stress is typically lower. Meanwhile, those with asthma might be scheduled for mid-morning or early afternoon. Another key point is team preparedness. Make sure everyone in your practice knows how to recognize the signs of an emergency. Does your team know where the emergency kit and oxygen are stored? Preparation is crucial for every dental office. Finally, patient education is essential. Before their appointment, remind patients about pre-appointment precautions, such as taking necessary medications and reporting any feelings of unease. Now let's dive into today's main topic: how to effectively manage a medical emergency. There are 6 fundamental steps to remember: stop, position, circulation, airway, breathing, definitive treatment. According to the American Dental Association, it's best to follow this sequence: position, circulation, airway, breathing, and then definitive treatment. PCABD. When you begin to sense that a medical emergency is unfolding, the first thing you must do is stop everything. Halt the procedure immediately. Clear the area around the patient. Remove any instruments to ensure a safe working environment. Next, let's talk about positioning the patient. How should you position them? Supine or upright? Don't worry, I'll guide you through the specifics in future videos, but generally, supine and upright are the most common positions to keep in mind. Moving on to circulation. You'll want to check if the patient's pulse is present and whether it's weak or strong. We'll explore this in granularity during our CPR video, so don't fret. Now onto the airway. Check if there's any blockage. In certain situations, a patient may be choking. The universal sign for choking is someone grabbing their throat. Keep an eye out for that. Identifying the cause is critical. Are they choking on an object or perhaps their own saliva? In some cases, suctioning may be needed to help prevent choking, and if they do aspirate, we'll discuss the necessary maneuvers in the CPR segment. Next, assess their breathing. Make sure the patient is breathing normally. Look to see if their chest is rising. If they aren't breathing adequately, you may need to provide oxygen. Finally, After addressing all the previous steps, it's time for definitive treatment. This involves administering medications tailored to each specific emergency, like epinephrine for anaphylaxis or nitroglycerin for angina. We'll delve deeper into all these medications when we cover each type of medical emergency separately, including how to effectively use an automated external defibrillator, AED, which we'll discuss in our CPR video. Now let's talk about essential emergency preparedness in dental practices. According to the American Dental Association, every dental office should have a set of 8 crucial emergency medications, often referred to as the Basic 8. These include epinephrine for severe allergic reactions, histamine blocker to manage allergic responses, albuterol inhaler for asthma attacks, nitroglycerin, sublingual, to treat chest pain or angina, aspirin for suspected heart attacks, sugar sauce to address hypoglycemia, naloxone for opioid overdose, oxygen for respiratory distress. In addition to these medications, it's critical for every dental clinic to have a robust medical emergency plan. This plan should cover prevention strategies, a clear action plan, methods for recognizing distress, emergency drugs and equipment. It's important to maintain a written and practiced medical emergency plan, as well as to have an emergency kit stocked with at least the basic 8 drugs. Ensure you have oxygen available and a method to ventilate, such as a mask or bag valve mask, BVM. Ideally, an automated external defibrillator, AED, should also be on hand. Training is essential. All staff should be trained in basic life support, BLS, or CPR, and conducting mock emergencies regularly will help ensure everyone knows their role when an actual emergency arises. Additionally, it's imperative to regularly review patient medical histories, vital signs, and any potential risk factors. Now, let's discuss red flags or situations that necessitate calling emergency medical services, EMS. If there is no pulse or breathing, and the patient is unresponsive, activate EMS immediately and begin CPR, BLS. Prolonged seizures require immediate activation of EMS. In the case of anaphylaxis, use epinephrine, maintain the airway, administer oxygen, and call EMS. For asthma not responding to the first-line inhaler, prepare to administer oxygen and call EMS if the patient does not improve. Chest pain, suspected myocardial infarction, MI, or angina should be treated with nitroglycerin and aspirin, and if you're uncertain or if the patient is at high risk, activate EMS. Lastly, if you're ever uncertain about how to handle a situation, it's always best to activate EMS. Taking all these steps can make a world of difference. Remember, being prepared is key not only to handling emergencies effectively, but also in ensuring the safety and comfort of your patients. I hope this information is helpful and clarifies the essentials of emergency preparedness in a dental setting. Thank you for taking the time to learn about this vital topic, and stay tuned for more in this series on dental emergencies. If you found this video helpful, please like, subscribe, and share with others.